Thank you for that introduction, Mark. I'm going to take you through the 2021 contribution increases and the 2021 benefit enhancements. So if we look at this slide, we have a few increases for 2021 for those schemes who have released their increases. 5% for Key Health, 3.5% for CAMF, 5.9% for MedShield, and 4% for BestMed. Unfortunately, with 2020 being an abnormal year, many schemes have delayed the launch of their contribution increases and benefit enhancements for 2021. Looking at this slide, what I want to demonstrate is the volatility of increases in terms of contributions over the 5-year period 2016 to 2020, including double-digit increases by most schemes in 2017 and 2019. When we look at Bankmed and the increases of over the same 5-year period, there's stability with regards to the increases over that 5-year period. Some schemes do have knee-jerk reactions to what is transpiring in the industry, example, claims experience, fraud, waste and abuse, and therefore explains the double-digit increases in 2017 and 2019. With regards to the increases for 2021, it's a 3.5% for CAMF, which is also a restricted scheme, and a 3.6% average contribution for Bankmed, which is very much aligned in terms of the increases. If we look at the increases across the different plans, it's a 2.5% increase on the essential and basic plan, a 3.5% increase on the core saver and traditional plan, and a 3.9% increase on the comprehensive and plus plans, giving us an average increase of 3.6% for 2021. Annual limits will generally increase by 4.5%. With regards to plan structure, Bankmed has a plan to suit everyone. We've got 6 plans. All plans are supported by our managed care programs and a very rich spectrum of wellness and preventative care benefits. All members have access to the wellness-based incentive program, Balance, that doesn't come at any cost to the member. If we look at the essential plan, it is the lean, low-cost plan, and benefits are limited to PMBs only available via the GP entry plan network. The basic plan has a wide range of primary care benefits, including non-PMBs, and this is available through the GP entry plan network. Core Saver is positioned as the hospital plan, with a savings component for day-to-day expenses. The traditional plan has a wide range of benefits with annual sublimits for day-to-day expenses, and it is regarded as our network plan. If we look at the comprehensive plan, it has a comprehensive range of benefits paid from both insured and savings out of hospital. The plus plan is top of the range. It is our Rolls-Royce plan, and it has both a savings and an ATB, which is regarded as a safety net for when savings are exhausted. High-level overview of the essential and basic plan. The essential plan is positioned for low healthcare needs. It is an entry-level plan and it covers PMBs only. The basic plan is a low contribution plan with in-hospital and out-of-hospital benefits and chronic disease benefits. The wellness and preventative care benefits, which is a very rich spectrum of benefits, is available both on the essential and basic plan, except for contraception, which is an exclusion on the essential plan. The restricted GP network and specialist network applies to both the plans. There is a GP specialist referral process in place for both these plans, and a hospital network applies to both these plans. With regards to radiology, pathology, and medication, restricted formularies apply. Managed care programs is basically PMB level of cover only. With regards to optometry benefit, there is no benefit on the essential plan. On the basic plan, members can access an optometry benefit through the ISOLISO optometry network. There is no basic dentistry benefit on the essential plan. Members on the basic plan have access to basic dentistry. If we look at the top 4 plans, the Core Saver plan is positioned for the young and healthy members with relatively low healthcare needs. It has a limited medical savings account for day-to-day expenses. The traditional plan provides comprehensive medical cover to meet moderate to high healthcare needs. It is a network plan. The comprehensive plan is a plan suitable for moderate to high healthcare needs for members who want a savings component. The Plus plan is designed for moderate to high healthcare needs for members who want a savings component and an ATB. The Wellness and Preventative Care Benefits, which is a very rich spectrum, is available to members on all 4 plans. In terms of a medical savings account, it's available on the Core Saver plan, the Comprehensive plan, and the Plus plan. The GP network and the Specialist network applies to all 4 plans. However, the GP specialist referral process applies only to the Core Saver and traditional plans. The hospital network applies only to the traditional plan. What this means is that the Core Saver, Comprehensive, and Plus plan have freedom of choice when it comes to hospitalization. With regards to managed care programs, the Core Saver plan is PMB level of cover only. The traditional, Comprehensive, and Plus plans have access to both PMBs and non-PMBs, subject to pre-authorization and clinical guidelines. Optometry benefit is subject to medical savings on the Core Saver plan, subject to insured benefit on the traditional plan. It is subject to a combination of insured and savings on the Comprehensive plan and subject to savings on the Plus plan. Basic dentistry is subject to savings on the Core Saver plan, insured benefit on the traditional plan, and insured benefit on the Comprehensive plan. On the Plus plan, basic dentistry is subject to savings. With regards to dental admissions, on the Core Saver plan, it's for emergencies only and PMB level of cover. Dental admissions are allowed on the top 3 plans. However, a deductible of 1,950 applies in 2021. If we look at the 2021 benefit enhancements, in a normal year, there are certain principles that underpin the annual review. These include enhancing benefits, innovation. These do come at a cost, but are necessary to remain competitive and be the medical scheme of choice for the banking industry. It is about optimizing risk management in order to keep contribution increases as low as possible. It is about a tiered differentiation in benefits between plans, especially for the discretionary benefits, where members perceive value and would therefore consider higher premiums justifiable. It is about lowering out-of-pocket payments and improving the member experience. However, 2020 has not been a normal year. We therefore had to think differently about benefit design and contribution increases. The decision made was to keep contribution increases as low as possible due to the state of the economy and the pandemic in favor of benefit enhancements. However, with the pandemic came lockdown, job insecurity, isolation, an increase in mental health issues. Bankmed, always having the member at the center and always responsive to employer group requests, decided that one benefit enhancement will be absolutely critical for 2021, and this is a comprehensive mental health disease management program. So before I get to the details of the mental health program, I just want to provide a few insights in terms of what's happening with mental health disorders, firstly at Bankmed and also in South Africa. So definitely mental health disorders are emerging as the #1 cost driver in the healthcare sector. The impact of mental illness is not only felt in the healthcare sector, It is also the largest contributor to global disability and accounts for 10 billion days of work lost on an annual basis. Depression is the commonest mental illness and accounts for more than 50% of cases. And also in terms of total spend, is responsible for more than 50% of total spend on mental health disorders. So as many as 1 in 6 South Africans suffer from anxiety, depression, or substance use problems. And this does not include the more serious conditions such as bipolar mood disorder or schizophrenia. This is according to statistics released by SADC, which is the South African Depression and Anxiety Group. Previously, the focus was on 4 chronic diseases: cardiovascular, diabetes, respiratory, and cancer, that contributes to 60% of deaths. The focus currently is on 5 chronic diseases that contributes to 75% of deaths, the 5th one being mental health. The very concerning incline in mental health conditions is certainly impacting productivity of the employee base due to absenteeism and presenteeism. It's impacting claiming patterns and impacting scheme sustainability. So what is the social impact of mental health on South African patients? 17% cannot take care of dependents, 26% are separated or divorced, 47% lose friends, a key part of their support network, 49% experience negative family relationships, only 27% of South Africans reporting severe mental illness ever receive treatment. This means that nearly 3/4 of these sufferers are not accessing any form of mental health care at all. South Africa has one of the highest rates of gender-based violence. 23 South Africans commit suicide every day. The lifetime prevalence of depression in South Africa is 9.7%, or 4.5 million. About 20% of South Africans will experience a depressive disorder at least once in a lifetime. Depression is a treatable condition, and between 80 and 90% of people have a good response to treatment. Depression also has a serious impact on the South African economy. It costs South Africa more than 218 billion rands in lost productivity. 28 billion is attributable to absenteeism, which is unscheduled absence from work. 190 billion is attributable to presenteeism. This is attending work while unwell. So the Mental Health Disease Management Program that will be implemented on the 1st of January 2021 is a comprehensive program that includes both out-of-hospital and in-hospital support. The following are some components of the program. Members on all 6 plans have access to the mental health program. However, plan benefits will apply with respect to condition cover. The program looks at strategies across the spectrum, from the healthy to those members requiring comprehensive inpatient care. The healthy and at-risk segments are promoted through regular screenings at wellness days and online. Access to a mental well-being module on the website, which includes information that promotes mental well-being, example, advice on mindfulness, meditation exercises. There is access to counseling should someone at risk wishes to speak to a counselor. It is a primary care program, which is GP level of care, and this is a crucial component and the mainstay of treatment. The Premier Plus network will play a pivotal role in this program. This network is already managing diabetes, cardiovascular disease, and HIV for Bankmed. Mental health will be an extension to the Premier Plus program. The GP will enroll the member onto the program, example for major depression, monitor compliance to medication, ensure follow-up visits, ensure script renewal. Coaching and educational material will be provided. The program includes a hospital designated service provider or network, which Bankmed is already participating in, case management, and discharge planning by care coordinator. On discharge, there will be enrollment on a relapse prevention program to provide the necessary support on discharge to prevent unnecessary readmissions. The implementation will be phased in. Integration with the employer's EAP is included as part of this model. If we look at frail care is an existing benefit. Members on the top 3 plans have access to this benefit. However, this benefit is complex. Currently, the benefit is 50% of cost, limited to 470 rands per day. In 2021, it will be a flat daily rate of 470. Thank you for your attention. I will now hand you back to Mark.